know good and well that the government did not just say that our healthcare is going to triple next month, but all of our tax-paying dollars went over to Israel to pay for their free healthcare. Free! They have free healthcare. We paid for it.
Everyone should cancel their health insurance today, and here's why.
There is absolutely, positively no way for anyone to budget 158% increase in your healthcare premiums that you pay out of your paycheck every 2 weeks.
I keep seeing posts on here of people talking about dropping their insurance for the new year, and I'm really thinking it sounds like a great idea.
Oh, that's just the cost of your healthcare premiums skyrocketing into outer space. Nothing to see here. Well, in case you missed it, the ACA, the Affordable Care Act subsidies are scheduled to expire at the end of this year, 2025. When these subsidies expire, ultimately that means that healthcare costs and healthcare premiums will skyrocket. Over the last few years, these ACA subsidies have kept healthcare premiums low for the average American. So when these subsidies expire, we could expect that we'll see people's healthcare premiums skyrocket, right? They might double, they might triple, going from perhaps a few $100s a month to a few $1,000s a month, especially if you have a large family. So while the government is still shut down and lawmakers are on now almost a month-long vacation, enjoying their free healthcare, we, the American people, are in for a world of hurt. It's basically like they're telling us, hey, if you can't afford thousands of dollars a month for health insurance, too bad. And if you die, you die. Before we get into these videos, I just wanted to take a moment to say, hello, my name is Miss April May, and I hope you're having a blessed day. If this is your first time visiting my channel, thank you for stopping by. And if you've been here before, thank you for coming back. Either way, make sure you like this video and subscribe to the channel so that you don't miss any of my upcoming videos. Now, let's take a look at what people have to say about the rising healthcare costs.
Not me having a mental breakdown in the parking lot at work because I just had to tell a patient that his insurance premiums are going from $160 a month to $580 a month with an $8,200 deductible.
Well, just found out that my district loves us teachers so much that they not only are getting rid of the healthcare plan that I had to switch to last year because the one I'd had for 10 years doubled, to now they've gotten rid of that completely. So I either have to go back to my healthcare, which I loved the provider, which is now doubled and I can't afford for my daughter and I, or I have to choose a different healthcare that we don't have access to easily where we live. And it's still way more than I pay a month. But somehow, they've decided that they've made it better for us.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
Obamacare was not a disaster, and I really wish y'all would stop spreading that lie. And it's got to be because either A, you're too young to remember what the financial market and environment looked like back in 2006, 2008, or you got a very short memory. I entered the workforce back in 2006, the same year I entered college, and the minimum wage was $5.15 an hour. Maybe 1 or 2 years after that, it was $6.55 an hour. At $5.15 an hour, $6.55 an hour, you were not getting insurance through the company. I remember that vividly. That premium was going to at least eat up 1 week of your check, and you only making $200 a week anyway. And you for damn sure wasn't going to get it privately because the premiums are even higher. This is why people back in the day told y'all, get a job with the post office, get a job with the city, get a job with the state, work for the government. Why? Because you may not get rich working for the government, but them benefits are going to make sure you're taken care of. But if you want to know the value of the ACA, you can just look at the benefits they celebrate. Do you know how many people were denied coverage due to pre-existing conditions? Do you understand how many people had the prices of their insurance jacked up just because they got sick? Y'all are harder on this legislation than y'all are on the companies that cause need for legislation. High premiums existed long before the Affordable Care Act. High deductibles existed long before the Affordable Care Act. Medical debt, definitely existed long before the Affordable Care Act. In fact, medical debt has always been one of the leading causes of bankruptcy in the United States. The Affordable Care Act was originally meant to be a step toward universal health care. The problem is nobody else has taken another step to actually accomplish the goal of universal health care for citizens of the United States. Y'all got to start doing some research on your own instead of regurgitating these talking points that are completely unfounded.
I think it's pretty obvious what happens when healthcare is unaffordable, right? People skip doctor's visits, people ration their medications, and then sometimes people just get sick, right? Completely outside of their control. They get sick or get into a horrible accident and end up with a crazy thousands of dollars worth of medical bills. These things happen to people every day. So, to me, seeing this fight that's happening between people on the internet as well as lawmakers in Washington over these subsidies is really mind boggling, because I remember the days pre ACA, before the Obamacare Act, right? And I think a lot of people don't realize that the Obamacare Act is the same thing as ACA. And that's also the same thing as like different healthcare programs, but in your state, different states call it by a different name, but they're pretty much all the same thing, right? So I remember those days where if you did not have insurance through your employer, if your employer did not offer it, you were kind of screwed, right? There weren't many options for you to go and get your own private insurance. Just like if you already had a pre-existing condition, it was difficult to get insurance. So the purpose of ACA was to make sure that if you wanted insurance, you could get it. Yeah, for a lot of us, it was never super cheap, right? I personally wish mine were cheaper or less expensive, right? But the option is there. So that was the point of it. Because before, I think there were a lot more people who just didn't have the opportunity to have health insurance. So, yeah, the Affordable Care Act is not a perfect system by any means. Yes, I know that. But, and in my opinion, universal health care will be much better. But either way, the ACA was meant to help people. It was meant to make health insurance more widespread, that if you couldn't or didn't get it through your employer, that you had another option. But now it's just so crazy to see how now these subsidies may expire in what, a little over 2 months. And you will have millions of people who will go back to the pre ACA days of just like not having insurance, not being able to go to the doctor. And then what happens? People don't go to the doctor. Like I said, they skip medication or just can't get medication. And then they wait until they are drastically ill and then end up in the emergency room.
So it's official. Congress waited too long to extend the enhanced ACA subsidies, and states say it's now too late to avoid chaos. Open enrollment starts November 1st, but insurers have already filed rates, assuming those pandemic-era subsidies will expire at the end of 2025. So that means people shopping for coverage will see massive premium increases, especially middle-income families who were protected by those expanded tax credits. So once those subsidies vanish, it's not just a few dollars. It could mean hundreds more per month for basic plans. And even if Congress tries to fix it later, states and insurers can't just flip a switch to reapply subsidies. Systems are locked, rates are approved, and the math is done. Any last-minute patch would cause billing errors, refunds, or people paying full price until corrections happen months later. So for millions who depend on these subsidies, this isn't a political problem, it's a survival problem. Missed medications, skipped checkups, and delayed care always follow when premiums spike. Nurses see it every single time affordability drops. This is the fallout of delay. Sticker shock is coming for ACA plans in 2026, and there is no clean fix left.
Hey guys, I want to show you something. So the rates for 2026 are out in Georgia for the Affordable Care Act. I just want to show you something. So let me switch this around. It'll let me, oh, I guess not. Hold on. Okay, so here is, we're still looking at plans for 2025. I have set my, this is like an Atlanta zip code, 40-year-old male, making $63,000 a year. They still get a slight discount. Okay. Let me see here. Prices, they were $425 a month. They got discount. Like the lowest Oscar bronze plan HMO is $343 a month. Now watch what happens when I switch it to 2026. Okay, same 40-year-old zip code, 63,000. Now, that's the cutoff for discounts for a single income household. So there's no more savings, and the prices are now lowest. So it looks like Oscar's not available in the state anymore. You can get an Anthem plan starting at $508 a month, which is exorbitant. Look at that deductible, $10,600. Crazy. Okay.
My husband and I just received our health insurance renewal package. We are both very healthy 30-year-old adult males who do not take any regular medications. We do not have any pre-existing health conditions. We do not regularly use our health insurance. We both get yearly physicals. Other than that, we make a concerted effort to not file claims as much as possible throughout the year. But nothing has changed as far as either of our medical circumstances or situations are concerned. Our health insurance premiums are going up 37% for next year. Right now we're paying around $950. We will be now looking at a little bit over $1,300 a month. For two people to have access to health insurance, that is $15,600 for next year to have health insurance for the both of us. That is before we even use our health insurance, before we ever have the ability to benefit from our health insurance. Just to get in the door, $15,000, almost $16,000 next year. How are people doing this? How are people doing this? I don't understand. How would we ever in a million years add children to that equation? What do you mean? What do you mean? $1,300 a month. Pretty much for the ability to just say that I have health insurance, not to use it. It costs so much more to use it. That's before our $5,000 deductible. That's before any health event that we have, before anything happens. If anything were to happen, it would still cost us upwards of $5,000 to have health care. And don't even get me started on car insurance. Don't even get me started. This is all coming on the heels of Allstate reaching out to us last week to tell us that our car insurance premiums for 3 vehicles, 2 drivers with completely clean records, absolutely 0 accidents, will be raised $475 over 6 months. $900, $1,000 a year more next year for car insurance. We had no accidents, we had no claims. Our salaries would need to go up $16,000 more next year. What are people doing? I don't know. It's not sustainable. I don't know what to do.
Hi. A common comment that I am getting on my posts is being very condescending and asking, well, how much are you spending on your nails? What about your car? One, I don't even personally spend $100 a month on my nails. And even if I did, do I not work a full-time job? Do you know what my salary is? I've never said what it is. There is absolutely, positively no way for anyone to budget 158% increase in your healthcare premiums that you pay out of your paycheck every 2 weeks. This does not, again, count for your deductible and for this whack term that insurers have come up with called coinsurance. There's absolutely no way to budget that. None whatsoever. Hard stop. Hard stop. As a working adult, and my husband is a working adult, we should be able to afford health care insurance. I was expecting it to go up. I was expecting a $50, $100 every 2 week increase. I was not expecting my premium to go from $230 something every pay period to $709. There's absolutely nothing I can cut in my budget that will cover that expense. Please miss me with those type of comments.
Hey y'all, I give up. I give up on my hair most days. I need to hear, so Idaho's open, I think Oregon's open, California's open, and it's the 20th. So there was a handful of states that the ACA opened early, and the rest of us, it's November 1st. I have a thread going over on Threads that has gotten hundreds of people with their amounts, and I want people to understand what is going to happen to their premiums and their out of pocket, their deductibles, their co-pays. It's going to go through the roof, and what I'm seeing is some are doubling, some are tripling. What I am seeing, though, is that deductibles, to make it even remotely affordable, are $10,000. So you might as well self-pay. So I want you to post what's happening in your state when you are going on healthcare.gov to renew your Affordable Health Care Act policy. And it's called different things. People call it different things. It's Obamacare, it's the ACA, it's healthcare.gov, it's, I don't know. Everybody has different names for it. I have been on it since its inception, since 2011. And it changed my life because as a small business owner, I have less than 50 employees. So I've never been able to buy policy, a group policy for my staff. And when I first started, I used to buy individual policies that literally covered nothing, and were still a fortune. They didn't cover pregnancy. If you had stubbed your toe, there was pre-existing conditions. Did you know that pregnancy is considered a pre-existing condition? Yeah. So when the ACA happened and pre-existing conditions became a moot point, we are going back there because I don't think that people understand. My partner had employer health insurance, and I would pick every single year of the 3 terrible plans that his Fortune 500 company would put out there every October, November. They're getting more and more bonkers. So post what's happening. Post what's happening when you're going on healthcare.gov and tell me what you're getting to choose from. I love you.
So between the healthcare companies charging these extreme prices, between the lawmakers in Washington not being able to agree on a deal, which is keeping this shutdown going, it feels like those entities are playing like shutdown roulette, or Russian roulette. But instead of it being a game for some money, they're gambling on the lives of the American people. And unfortunately, I think a lot of people won't really see what's going on until they have to enroll in their health insurance. And I think a lot of people really won't see what's going on because they get employer based health insurance, right? They have a job that offers health insurance. But even some of those people, from what I've heard, their insurance premiums may go up because it's not just through the ACA and the marketplace where the premiums are going up. I believe it's across the board because these insurance companies are just charging ridiculous prices for services. Something else that I've noticed, especially on TikTok, reading the comments and watching videos, is people talking about potentially just because already they're like, okay, I'm not going to be able to afford insurance because the price is going to go up for 2026. But aside from that, people are talking about like going and getting a high yield savings account, taking the money that they would typically pay for premiums and putting it in that account, or getting like catastrophic plans, which will cover things like extreme illnesses like cancers and leukemia and things like that. Or if you get into a very horrible like car accident or something like that. or using like community-based programs where you just pay a small fee every month and you could at least do like your basic preventative health care, right? So going to see a primary care doctor, getting like routine blood work, things like that. So I've been noticing that people are trying to find alternative routes. And that makes sense because if we live in a world where you have insurance, and health insurance in some ways is just like car insurance, right? We have car insurance and you have it just in case something happens. You hope you don't get into an accident. You hope you don't have to make a claim, right? And deal with Geico and Progressive or whoever, right? You hope that you don't have to do that, but you have that insurance there just in case. So, in the case of health insurance, where people are already being denied their claims, where health insurance companies are arguing with doctors and other healthcare professionals about the services and the care that they're providing, as if these people didn't go to school for years and years and years and study all of and pass all of these exams and board exams and state exams or whatever. Why would people still believe in the healthcare system to begin with? Why wouldn't people try to go and find an alternative route? So we'll see what happens there because honestly, this potentially with the subsidies issue, if it's not passed, and then you have droves of people who in 2026 are uninsured, this could potentially be like the failing of the American healthcare industry. I can't I can't see what else would happen after this unless there is new legislation to follow up. So now we have gotten to the place where having healthcare no longer feels like the safety net, right? A just in case. Instead, it's starting to feel like a burden because imagine already having to pay, for example, like $300 a month for your basic healthcare plan. And then being told in January 2026 that 300 will go to like 1200, right? So that money that you already didn't want to pay anyway has now like quadrupled or whatever, because I don't do math, but it has gone way up, right? So now this thing that was a safety net is no longer a safety net. Instead, it is cost prohibitive. It is a burden now to your life. So many people will just drop it and decide to look for alternatives or just pray for the best. So, what's going to happen in the end if these subsidies expire? People will just completely drop their insurance and they won't be able to go to a doctor for like preventative measures. And they'll only end up going to the hospital, to the emergency room when they're extremely sick. So, it won't just be that person at the hospital, it'll be a bunch of other people too, because there will be millions of other people in the same predicament, right? So you're going to be talking about longer wait times, more people waiting, other patients waiting. Staff will be more stressed. It's already a stressful job, but imagine going from maybe having like 10 patients to 15. So the entire system will be more overwhelmed. And when there isn't an insurance company to pay for that emergency room medical bill that's, $10,000 or something like that, the hospital is going to have to end up eating that cost. And then what's going to happen to that hospital? The hospital is going to close because how long can a business continue to eat costs? A hospital can't do that forever. Not even a large hospital system can do that forever. So eventually hospitals will close because they just don't have the money to take on all of these new free patients.
What's happening is healthcare is going down the drain. That's why I advise healthcare workers to have a plan. So a lot of hospitals are trying to save as much money as possible. Why? Because they're going to feel the grunt of Medicare and Medicaid no longer having funding. So what happens when a patient comes to a hospital and they have a 10-day stay and their stay is $50,000, their insurance covers it. So what happens when someone who was formerly on Medicare or Medicaid or did not have insurance and they were going to be covered on Medicaid comes in and their hospital bill is $50,000? The hospital is going to eat that cost. The hospital cannot continue to eat these costs. They will go broke. And what happens when a hospital goes broke? It will close. Hospitals are businesses. They're built on a business model. It's not for the people. It's for profit. So you might be thinking, oh my God, but my hospital is so needed in this area. Like they're not going to close. Maybe these other hospitals, but my hospital is so needed. Like we have 400 beds and it's a level 2 and it saves and cares for all these people. Your hospital's a business. I worked at a hospital, that was needed in the area that it was in. It had hundreds of beds. It was almost always full. The ED was slammed. Like, you would think that this hospital would never close. Oh, it did close. And what you'll see is first they'll close L&D, then they'll close step down. They'll try to reduce the amount of nurses. They'll try to minimize the amount of floors. They're going to put pressure on you nurses to take more and more patients until that place closes. And then what happens when your hospital closes? The other surrounding hospitals feel it. So your ED wait time when you go in as a patient is no longer 10 minutes, it's now 40. And also why? Because a lot of people are not gonna be getting primary care. You know how your kid has a little cold and you go to your doctor's office and they prescribe you something or they give you your management and that's that? People are no longer gonna go for primary care because they don't have it. They're gonna wait until their kid now has a major disease or problem, infection, and now they're in the ED. Things are going to get bad. If you watch this and think, oh, well, I don't work in healthcare, so it's not going to directly affect my job. And then in terms of me, I have a lot of money in insurance. Like, I'm above this. You're not. As healthcare workers, we honor the law EMTALA. That means we serve anyone and everyone that walks through the doors, regardless if you have insurance, money, if you're here legally, doesn't matter. We have to help you. So when you walk into that ED wait room and your wait time is 5 hours and you're like, oh my God, but I have money and I have insurance. Like, why aren't they covering me? And a homeless guy walked in and got a turkey sandwich and he said he had chest pain. Like, why is he before me? It's because we prioritize based off of healthcare needs, not money or insurance. So that's not going to matter. So if you sit in that ED waiting room for too long and God forbid something happens because you didn't get care immediately, are you going to care now? I'm not making this video to be dark or like scare anyone. This is just the reality that we're facing. So we might as well all just be aware. So that's why your hospital's canceling your shifts.
Everyone should cancel their health insurance today, and here's why. Number one, it's a racket. Number two, I have paid cash for any services that I've needed, and it's actually cheaper when you pay cash. Insurance is such a racket that if we all canceled it, they would have to do something about it. They would have to change it because they operate on our fear of getting sick, our fear of something catastrophic happening. You know what? If you racked up $100,000 bill, you pay them whatever you can per month for the rest of your life, if that's what it takes. But this fear and paying, my friend said she pays $18,000 a year in insurance. I said, what if you put that into a high yield savings account and then if you ever need something, you have the cash to pay for it? I'm just saying, if we all canceled, they'd have to do something about it.
All right, I'm gonna need somebody or like several somebodies to de-influence me, okay? I keep seeing posts on here of people talking about dropping their insurance for the new year, and like, I'm really thinking it sounds like a great idea. Everybody's already paying like a shit ton of money for our health insurance, and then for some reason, if we do go to the doctor or the hospital or something, we're paying more money because we have insurance than if we were to go in there and not have insurance. So like, I'm paying for insurance just so I can pay more money? That doesn't make any sense. People are talking about setting up like a separate savings account and just putting what they would be paying for insurance every week or like bi-weekly or from every check and just putting it into this account and then having that account for any kind of medical needs. And I gotta say, like, it really makes sense to me because at the end of the year, you're normally not even having that much go on, like knock on wood, but I don't know, it's making sense to me. I need somebody to de-influence me, tell me what's wrong with that plan and every in and out between it.
So as of the recording of this video, we're only a few days away from open enrollment, which starts on November 1st. Which, crazy enough, is the same day that food stamps are supposed to be cut off. And if you want to see a video about that, I have one about the food stamp prices that is also coming November 1st. So I'll link that in the description box. But anyway, so on November 1st, that's when open enrollment starts across the country. But so far, a few days before November 1st, in some states, you can go into the, I guess we call it like the marketplace portal and see how much your insurance would be for 2026. I haven't done it yet because I'm scared. I'm not brave. But so people are already seeing how much their health insurance will be for 2026. So I'm going to put some of those comments here in the video just so you can see, because these prices are crazy. I just don't know what millions of people are going to do come January 26th, myself included, more than likely. So Let me know how much you'll be paying for 2026. Has your health insurance premiums gone up? Have your deductibles gone up? Because I've also noticed that people saying the premium and the deductible has gone up. Some people have said that the health insurance that they have now, or the plan that they have now in 2025, is no longer available for 2026. So please let me know in the comments what your health insurance premiums and deductibles are looking like for 2026. Will your plan still be available? Is it something different now? Just let me know. Log into your portals. Let me know the prices. I'm very curious, and I want other people in the comments to see as well. So I want to thank you for watching this video. Please make sure you like the video and subscribe to the channel so that you don't miss any of my upcoming videos. My name is Miss April May, and I'll see you on the next one. Bye.
You're officially coming with me. You got that. You're the drunk.